Hello, it's Dr. Dave Pascal. Welcome to my Facebook Live, and today we are going to talk about pain and your sensory nervous system. Okay. Well, people with complex regional pain syndrome have pain. They have a lot of pain. They have unchartable, unbearable pain. A 1 to 10 scale does not do justice to the level of pain that complex regional pain syndrome patients are suffering. A lot of people that are seeing CRPS patients are using a 1 to 20 scale. And at 20, what that means is it doesn't matter what you do to the body, there cannot be any higher pain. It's just you're at the highest level that you can perceive. It is truly terrible. And a lot, because there's pain and that is what people are suffering from, most people that have CRPS, they're going to go to a healthcare provider and they're going to say, hey, I have pain. And the healthcare provider is going to try to do something to lower the pain. And if it's a medical doctor, which most people with CRPS go see someone in the medical world first, they are going to try different drugs. They're going to start with small, easy drugs, maybe nonsteroidal anti-inflammatories like Tylenol or Advil or aspirin, but that's slowly going to start ramping up to stronger and stronger and stronger drugs, eventually getting to drugs like ketamine. And they'll even try putting people in ketamine comas, put them in a coma, pump a bunch of ketamine through their body for a week or even a month, and then take them, in an effort to reset their pain perception or their pain nerves. And they'll take them out of the coma and the pain is still there. They'll do nerve ablations. They will literally cut the pain nerves either peripherally, like going from, let's say, someone's foot to their spinal cord, or try to put an implant, a spinal cord stimulator, into the spine to fire signals on the pain nerves to stop the brain's perception of pain. And these types of treatment modalities are not successful. There is only a very small percentage of people with CRPS that are getting relief with these therapeutic approaches to pain. So how can that be? How can someone have horrible pain, but the pain nerves aren't the problem? The analogy that I most commonly will use is having water on your kitchen floor. You can have water on your kitchen floor and that's the problem. But if the cause of the water on your kitchen floor is a hole in your roof, then it doesn't matter how much you wipe up the water on your kitchen floor. As long as it's raining, you're going to keep getting water through that hole in the roof. And it's the same thing with the pain nerves. I don't believe CRPS is a pain nerve problem. Yes, you have pain, but it's not the pain nerves, because any therapies that we do for the pain nerves are not getting rid of the pain. I believe it's all or some of the other sensory nerves that are overfiring, misfiring, that are then irritating the pain nerve, and then the perception of pain is high. So what are the other sensory nerves? We have light touch, we have vibration, we have deep pressure, we have circumferential pressure, we have 2-point discrimination, which is the body's ability to tell how far apart two things are. Like if I took my fingers and I touched my cheek, right? Or someone touched me with my eyes shut and I said, oh, those fingers are 1 inch apart, or they're a 1/4 inch apart, or they're, 3 inches apart. That is a specific part of your nervous system called 2-point discrimination that figures that out. There's another thing called form recognition, which is you can hand an object to a person behind their back, right? You can give them a ball or a cube and then ask them what it is. Or you can draw on their skin a square or a triangle or a circle and ask them what that is. Those are all specific parts of the sensory nervous system that are sending signals to the brain to say, oh, this finger's poking me, or oh, this thing is vibrating, or this thing is hot or cold or warm or damp. And I believe with CRPS, it is those other nerves that are overfiring and irritating the pain nerves, and then the person has pain. And when, as part of my program, I specifically address all those other nerves, those other sensory nerves. And when we do that, that is a big part of our success. I use very specific advanced neurologic techniques to reset those other sensory nerves, and that plays a major role in lowering pain for CRPS patients. So I hope that's helpful, and I will open the floor for some questions.
So the first one is, how is the sensory nervous system different than the sympathetic nervous system, and is one more dominant in active CRPS patients?
Good question. So how is the sensory nervous system different from the sympathetic nervous system? So technically, the sensory nervous system is a separate part of our autonomic nervous system. So the autonomic nervous system is that part of our nervous system that we don't have control over. And there's two parts: sympathetic, which is our fight or flight, go, 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 and parasympathetic, which is rest, digest, and heal. And so, of course, people with CRPS, they're going to have dysfunction in their autonomic nervous system, and part of that is dysfunction in the sensory part of the nervous system, and you have to approach those differently, because the primary role of sympathetic is that fight or flight, so our respiration and our blood flow, food digestion. So we're doing specific treatments for those, which are different from firing those peripheral sensory nerves. Peripheral means outside of the spinal cord, so the nerves that are running down your arms or legs, for example. Next.
How important is the vagus nerve to managing pain?
Yeah, so vagus nerve has a big role in managing pain. Now, the vagus nerve is not a peripheral nerve, that is a cranial nerve. It's a nerve coming directly off the brain, going basically to all the organs and glands in your body. It's the longest nerve in the human body. It has lots of branches. Vagus is, I believe, Latin for wanderer, and that nerve kind of wanders all over the body, and it's giving feedback to the brain basically on the idling speed of that organ and gland. And when we have CRPS, then of course we have this massive overfiring of our autonomic nervous system, of all of our nerves, our peripheral nerves, our cranial nerves, the central part of the central nervous system, which is our brainstem, spinal cord. And the vagus nerve's role is trying to calm all those things down. So when we have all this pain, of course, the vagus nerve is going to overfire, and it's going to become hypersensitive, and then it's going to become instead of the hero and the rescuer, it's going to become part of the problem, because it is being overused. So again, with CRPS, not only do you need to address the sensory part of the nervous system, you need to, and the motor part, those are the nerves going to the muscles, you need to address the entire autonomic nervous system, the sympathetic and the parasympathetic. The vagus nerve helps move us into a parasympathetic state. We can only heal in a parasympathetic state, in much the same way that you can only change your car tire if you stop your car. If you have a flat tire, you got to pull the car over, you got to stop, you got to jack the car up and change out the tire. You cannot be sympathetic dominant, go, 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 and heal. It just doesn't, body doesn't work that way. And vagus nerve is playing a major role in that. So by calming down all the different nervous parts of the nervous system, that's going to allow the vagus nerve to do a better job. You need to help heal the vagus nerve and reset it so that it will have appropriate functioning and not hyper or hypo functioning. All right. Well, that was fun. I hope you had your questions answered. Please feel free to share this video with your friends and other people that have questions about CRPS. I am committed to being here every Tuesday at 2 o'clock East Coast time to do a live into my group. You're welcome to join in and ask me questions, or if you know that you're not going to be able to be here live, then you can send Danielle your questions in advance and we will do our best to answer them during our live. So hope everybody has a great week and we'll see you next week.